I am a 12-year leukemia survivor, and have been very fortunate that I live in a country where we do have pharmaceutical companies that have found excellent drugs to treat these things. When I was diagnosed 12 years ago, I was told of a drug that I take, and they said, you take it, it's an oral chemotherapy, you take it every day, once a day for the rest of your life. You should live a happy and normal life. That sounded okay after a cancer diagnosis. The challenge came when I went to order the drug, and I was asked to pay $1,200 for a 1-month supply. I was 43 years old. I was working. I have 2 young daughters. That's almost my mortgage payment. We made those sacrifices to keep me alive. I've lived through foreclosure notices being attached to my front door because I've skipped a couple of mortgage payments to take my chemotherapy drug. We've come home to the lights being off because I've made the choice to pay for my chemotherapy drug to stay alive. At one point at the beginning of the year, I was faced with the pharmaceutical company telling me that I would need all $10,000 in January to receive my January prescription. They were lump summing everything together. This was about 4 years ago, and it was fortunately fixed with the benefit of one of my legislators who I had reached out to help me with that problem, and we were able to get that corrected. But much like many Pennsylvanians, I have made the decision at times within the past 4 years ago, with my 2 kids in college, tuition payments coming up in August, and skipping a $900 prescription for the month of August. That's a lot on a cancer survivor. That's a lot to process. And that was a long, not just the 30 days skipping the medication, but the 90 days waiting for the blood test results and getting the blood test results to see if my leukemia had spiked or come back because of that financial decision that interfered with my healthcare. Without these medications, my life sentence would have been, I would have passed away 3 years after my diagnosis.